Placebo and nocebo effects explained. The placebo effect, Latin meaning I will please, is considered to be a beneficial effect produced by a placebo drug or treatment, which cannot be attributed to the properties of the placebo itself, and must therefore be due to the patient's belief in the treatment. The nocebo effect, Latin meaning I will harm, is said to occur when negative expectations of the patient regarding a treatment cause the treatment to have more negative effect than it would otherwise have. To create this effect on purpose is generally considered to be unethical. There is proof that you can radically alter your body's physiology just by changing your mind. There is also proof that you can make yourself sick when your mind thinks unhealthy thoughts. There are tons of clinical studies to support this. Approximately 40% of people with headaches get relief when given a placebo. Half of people with colitis feel better after a placebo treatment. Half of asthma patients get symptom relief from taking a fake inhaler or sham acupuncture. Sham acupuncture cuts hot flashes almost in half, and real acupuncture helps only a quarter of patients. As many as 40% of infertility patients get pregnant while taking placebo fertility drugs. When compared to morphine, placebos are almost equally effective at treating pain. Almost all of the happy-making responses patients experience as a result of antidepressants can be attributed to the placebo effect. Bald men can grow hair. Blood pressure drops. Warts disappear. Ulcers heal. Stomach acid levels decrease. Colon inflammation decreases. Cholesterol levels drop. Jaw muscles relax and swelling goes down after dental procedures. Brain dopamine levels increase in patients with Parkinson's disease. White blood cell activity increases. And the brains of people who experience pain relief light up on imaging studies. Are certain types of patients more susceptible to placebo responses than others? Is there any data to suggest whether there is a classic profile for placebo responders? Are there personality traits or intelligence measures that predict who gets better when given a sugar pill? Nearly everybody can be induced to respond to a placebo under the right conditions. We are all susceptible, even doctors and scientists, and there may be several reasons for this. Because of the ethics of informed consent, patients know they may be getting or receiving a placebo, but many patients in a placebo group believe that they're getting the real treatment when they're not. So they expect to get well. So in other words, the belief that you will feel differently leads you to feel differently. Also, the support of a respected authority figure may account for as much of the placebo effect as a positive belief, or even more. We all want to feel seen, heard, and even loved, and this alone may relieve symptoms and stimulate positive physiological change. Now, although physiological changes experienced with the placebo may not be the result of positive belief alone, the placebo effect nonetheless confirms a mind-body link and the body's innate capacity for self-repair. Now, what are some of the physiological mechanisms that explain how thoughts, feelings, and beliefs maybe translate into physiological change? Thinking positively about getting well may stimulate natural endorphins, which help improve symptoms, relieve pain, and lift your mood. The reverse is also true. So when patients who responded positively to placebo were given the opioid blocker naloxone, which blocks natural endorphins, the placebo suddenly stopped working. And actually, many with Alzheimer's disease failed to respond to placebos, supporting the idea that an area of the brain is related to belief, which may be damaged in a neurological disease state. And that affects whether or not a patient can respond to placebos. So what the brain expects to happen in the near future affects its physiological state. So those with Alzheimer's don't experience a placebo effect because they're unable to anticipate the future. So their minds cannot physiologically prepare for it. Now, placebos seem to be most effective when given to patients with immune system conditions such as allergies, endocrine disorders such as diabetes, inflammatory conditions such as colitis, mental health conditions such as anxiety and depression, nervous system disorders such as Parkinson's and insomnia, cardiac symptoms such as angina, respiratory conditions such as asthma and cough, and most effectively pain disorders. But do placebos work to treat cancer, heart attacks, strokes, liver failure, kidney disease? There really isn't a lot of data to answer that question. And perhaps because treating conditions like these in a clinical trial with a placebo would be considered unethical. With these kinds of life-threatening conditions, new treatments are usually studied under the gold standard treatments that already exist and have been proven to have at least some efficacy. So it's really hard to know the limits of what will and won't respond to a placebo. Now, there are many studies that suggest that negative beliefs affect your health. One study showed that 79% of medical students report developing symptoms suggestive of the illnesses that they're studying. Because they get paranoid and they think they'll get sick, they do. So excessive knowledge of what can go wrong with the body can actually harm you. So the more you focus on the infinite ways in which the body can break down, the more likely you are to experience physical symptoms. And scientists call this the Nocebo Effect. Now, if you tell patients in a clinical trial that they'll be given a pill that will relieve their pain, there's a good chance that the pain will go away, even if they're only given a sugar pill. But if you warn them that the treatment might cause nausea and vomiting, there is a high likelihood that they will puke, even when they never got the real drug. Even thoughts about death seem to play out. Some surgeons are wary of people who are convinced that they will die. There are some examples of studies done on people undergoing surgery who almost want to die to recontact a loved one. And close to 100% of people under those circumstances die. One fascinating case study described a psychiatric patient with a split personality. As one personality, the patient was not diabetic and her blood glucose levels were normal. However, the moment she became her alter ego, she believed she was diabetic and she literally became diabetic. So when her personality flipped back, her blood sugars returned to normal. Scientific studies investigating the nocebo effect can be ethically challenging since it's hard to get an institutional review boards to approve studies designed to intentionally make patients feel worse. Because of this, there's less data to support the existence of the nocebo effect than the placebo effect. Most of what we know about the nocebo effect comes as a side effect of clinical trials that include placebos. Scientists believe that the nocebo effect is caused primarily by the activation of the same stress response that the placebo effect relieves. When patients in double-blinded clinical trials are warned about the side effects that they may experience if they're given the real drug, approximately 25% do experience side effects, sometimes severe, even when they're only taking sugar pills. The nocebo effect is probably the most obvious in voodoo death. When a person is cursed and told he or she will die and then dies, that's what the voodoo death is. So the notion of voodoo death doesn't just apply to witch doctors and tribal cultures. The literature shows that patients believed to be terminal who are mistakenly informed that they have only a few months to live have died within their given time frame, even when autopsy findings reveal no physiological explanation for their early death.